Good evening, everyone, and welcome to the fourth session of our openIMIS online training. This is the last webinar for the first module. Please be reminded that participants' microphones are muted during the speaker's presentation and webcams will not be used in this call. If you have questions, you may enter them in the chat box anytime. Our facilitator will answer them in between the sessions. So may we now call on Sir Siddharth to begin the training.
Thank you, Cha, and also welcome from my side to everyone who's joined the training today. As Cha briefly mentioned, this is the last of the series of webinars that we were doing on the first module, the so-called Introduction to openIMIS. And my name is Siddharth. I work for the Swiss Tropical and Public Health Institute based here in Basel, and I work with the initiative to support on capacity development resources like we are doing right now with this training here. Just to do a small recap, before in the earlier three sessions that we've done, we've started with a general introduction, and then session 2 onwards, we really delved deeply into openIMIS, and we've tried to gone through the construction, the so-called construction of a scheme. So how do you do configurations within openIMIS? And today I will focus in the remaining part, which is really transactions which are happening within openIMIS. This is kind of the overview which I started with last time. So basically the point number 1 and 2, that's what I've covered in the last session. And today I'll be covering everything that falls under point 3. So you will see today all the configurations that you did, the step-by-step, building health facilities, price list, etc., how it now falls together in undertaking different transactions within openIMIS. So how I will do this, I'll again structure the time split would be something like this. The emphasis is really on practicing. So I will try to also squeeze the time and do less talking and more showing and asking you to do these exercises. So we'll have 2 blocks where we'll do these exercises, and otherwise I will try to cluster some processes at the beginning, a couple of them, and then split it across these rounds. And then of course at the end we have questions. At any point if there are questions, please type them in the chat and we'll try to pick them up. Okay, so the first process, which I also mentioned earlier, this is one way of categorizing how an insurance scheme functions, a health insurance scheme functions, and we split it across these 4 structured processes. So I'll start with the enrollment process. And before going and showing on the system, it's always good to understand, have some kind of visualization of how this happens in reality before then going onto the software and then doing this entry. So as an example, in openIMIS, in a lot of contexts, it follows this logic where you proactively go and enroll people into a household. So what I mentioned before, the accounts you created, this enrollment officer, that's really the outreach of an insurance scheme, which goes to the household, convinces them, and if the family then decides that they would like to enroll, at that point, some information needs to be captured. So each individual which is registering into from that family into the insurance program, all of their individual details have to be captured and also something to identify them with. So photos right now are captured. As well, some payment has to be taken. Now, all of this information, it depends on different context, how this is happening. But I speak of one context, for example, in Tanzania, where the mobile phone is actually used also to capture all the details of the individual. So at one point, the pictures are taken, all information for that individual is taken, and money as well. They are using mobile payments. So money as well on the spot gets taken, collected, and it's paid through mobile money transfer. So all of this information gets directly sent to the insurance side and to activate the policy at one go. But of course, as I said, there's variation. Some schemes also collect this information, for example, in paper, and then they get it transferred back to the insurance office, where someone on the office side then enters it directly on the web application on the central server. Cards are issued on the spot. So the way right now all openIMIS schemes function is there's a simple card which is issued, which has basic information and a barcode. And the idea is that when this person goes to, when you want to get more information on the individual, you use the barcode or the ID number written underneath it to scan and then retrieve the information from the central server. So in reality, that's kind of the information which is captured, card issued on the spot, other information which is provided. And this information is then sent back to the insurer to activate a policy. Um, that's in a nutshell kind of how the enrollment process functions. The same way, I'll just cover health service utilization and then go to the demo server to explain how this functions. Uh, in reality, as I mentioned, an individual now who's insured has this card, and that person then goes to the healthcare facility with this card. The card is then shown, and using openIMIS, a verification is made of this individual. And if the individual is found to be all details are correct, it's valid card, it's active policy, the services are going to be covered as an insured person, then the person is treated as an insured person, and in other cases not. So here the function basically of openIMIS in this whole process is really enabling through this card information of that individual to be retrieved and be verified. So now this is what I will show you on the server, and essentially on the mobile phone as well. The interfaces are very similar, whether we talk about the enrollment part of the application or on the health facility side, the second app, which is for claims management, the inquiry, which I will show. These are all, the interface might look a bit different, but essentially the data elements which are being captured are exactly the same. I will show everything right now on the demo server directly, so that when you also practice, you can practice it here. So on the demo server, I again log in with the given credentials which are there. And we start with, as I said, insurees. Now the logic here is, so I showed you the process which happened, and we always start with the head of the family member. So also at the time of enrollment, when the enrollment officer is doing this, they always ensure that the data is always captured first for the head of the household, the so-called head of the household, because in IMIS, that's how you start always with the head of the household and then associate all the other members to that head. So I will not select all of the fields. You'll see here quite a lot of fields. I'm only doing the red ones, which are the mandatory ones. And what you see in this screen is quite a lot of data fields here. And this is the case because it's a unification of all kinds of different data fields which are being used in current openIMIS implementations. But in respective countries, they customize this and use the fields which are relevant to them. So now pictures here are always sent from the mobile phone. So since I have not using the phone, it's currently blank, but the information here should be linked directly to the picture based on what has been sent from the app. So I'll right now do it without a picture. Entering, just as I said, the basic details. And we'll come back in a moment here with an exercise where you will do the same. So I am starting here with the head of the household, who in this case, let's say, is a test case. I will not add all of these additional fields, but you can have a look and play around with it. You can have cases where, for example, there is a permanent address of this household, but maybe individuals might be located, let's say, temporarily. So the current address can also be different for an individual. But the household address is really the permanent address which is indicated here. If you don't use it, leave it blank. And there's plenty of other data which is captured. FSP is the first point of service point which is allocated. So in case you have schemes which restrict the first point of care of an individual who's insured, if they allocate and say, okay, you need to go to this health facility, then you can indicate that here as well. And if you leave it blank, it means the individual can go anywhere. And as you see, this is where some of your configurations also start showing. So you had done configurations on locations, and that's what you see here in the drop downs, which are showing what you have configured: districts, municipalities, etc. Now, what you see on the screen here is, this is what a family page then looks like. I've started with one individual, and this is the head of the household right now. The next step is always to create the full family roster. So if there are more people in the family, you click on the plus and you add additional members. So here I will add another person who is, let's say, the wife of this person. You can indicate relationship, etc. And the same way, all the details which you had for the head of the household, you can also capture here for the second individual. And like I said, it depends. It can be a very compact form and you have only mandatory fields. That's up to the scheme to decide what kind of data they want to capture at the time of enrollment. So this way now I've created a family roster here of 2 people. The next thing is then sequentially, obviously, then linking this family to a policy. So if you remember, we've worked through the so-called products page, and now you are essentially indicating this family's affiliation to a particular product. So let's say I start with today's date. The system then checks what products. If you remember again in the products, there was an indication of starting date. So I indicate some kind of product here and say the start date now of the product is as of today. Expiry date is within a year, and these are based on the configuration of the product. The price as well, we had configured in the product, and that you see here, it's a group price of 10,000 for any family. And then I select the enrollment officer who's done the enrollment. And in the case of the apps, basically the app always has, as we mentioned before, a login. So that's also the login of the enrollment officer. So this here is an enrollment officer who is then sending that information. And in case now, if the paper form comes to the insurance office and they are doing the entry, they can select then whichever enrollment officer was allocated or has done the actual registration of this family. Now you see the policy is added here. There's no effective date yet. And you see the policy status is idle. And that's because no payment has been done against this policy. So I select this policy and then add a contribution, a payment towards this policy. And here you indicate if there is a payer. In this location, there is not. But if you had, for example, what I covered before, a third-party payer, it would show in this list. If you leave it as it is, this basically means that the family themselves, the head of the household, has basically paid for it, for this premium. Then you have the contribution amount. You select that. It matches the policy value. Balance is 0. As in any financial transaction, you will have a receipt number, which might have been issued for that payment. And I save this payment. So you get a message saying contribution matches the price of the policy. And now what you see here under the policies is that there is an effective date, which is as of today, and the status of the policy is now active. And that's because now the contribution is complete and the policy has become activated. And now this individual, basically, once this activation is done, when the individual goes to a healthcare facility with their card, there's either the code which can be scanned on the phone, or if, let's say, like in Nepal, they have users who are having direct access. They have computer in the hospital. They log in directly to the system with their ID. And in this way, like I see on the top right here, they essentially make a query for the individual. So if you don't scan, you can also type in the number directly, like I have done it here, and you essentially check who this individual is. So I get information here. Ideally, I would have also a picture, the details of the person, the age. So I had put in a very young person here. So you see 11 years, male. So this way, using all of this information, the person at the health facility can make a check whether this is the individual who's come now for treatment. And at the bottom, there are lots of these fields which basically indicate to you. So here, for example, the coverage. So the policy is active and the policy will expire next year. So this person can benefit. And there are no ceilings as per the product. If there was a ceiling, say a total amount or so, that would then feature here. So this way, the facility then can query and know whether an individual has had, what kind of benefits are remaining, and then accordingly treat them as an insured client or an uninsured client. So I will stop here briefly now and quickly go back to one small exercise which I'll ask you to do. What I will suggest is that we'll split you again into small groups and then bring you back again after 10 minutes. And in that time, if you can go to the demo server and do exactly what I did right now, which is to add a family with 2 family members. So as I said, start with the head of the household and then the subsequent members of the family. So add 2 family members. Just keep a note of the ID number that you use for this person. In case the number is duplicated, you'll get that message in the system. But otherwise, feel free to add in any kind of ID number, but just keep track of it so that subsequently you use the same individual you created to also add a claim for that person. So you go in sequence, add a family, then add a policy, add a payment, and then activate the coverage. And just as I did it on the top right, just verify the status of this individual. So I hope this is clear, and this was also shared with you before. So I hope you know the task very clearly. And Cha, I would then request if you could split people maybe 10 minutes and then bring them back. Since we are less, maybe let's just do 4 rooms or so. And if there are questions, please just type them in the chat and we can try to help you out. All right. I hope you were all able to at least attempt at doing this. I was looking on the side at what was coming into the system. So we basically had here families. I saw we were around about 32, 34. Okay, so I can see some people have at least added their families. If there are questions coming up, okay, I opened one of these. I would just ask you maybe the idea was if you could also allocate a policy as well as a contribution against this family, you would then be able to practice the same individuals in the claim section. So if only you have an active policy for an individual, will their claim actually go through? Otherwise, the claim will get rejected. So if you were not able to complete this whole process and add a policy as well as contribution to activate the policy, then maybe don't use the ID number which you see from here. Perhaps use a different ID number. And I mean, on the system, you can just take any of these ID numbers. Otherwise, I'll put it in the chat. I've put a dummy ID number there, which I know is there in the system, and the policy for this individual is activated. So if you were not able to complete this part, policies, contributions, you can of course do this later. But for the claims exercise, probably try to use this number, which I've just typed into the chat. This question someone has asked, I'll quickly just answer it. Yes, you can create 2 insurers and link them into one family later. The point is you always need to create, the starting point is the household head. So you can have basically 2 families with 2 different household heads. And then later there is the function here on the top here with the family and group, where you can actually start to move people across families. So the logic would only be that if you have 2 different families, so for example, in reality, a case could be, let's say if there is a marriage which happens. So you have 2 families where let's say both were insured, but then after marriage, maybe one individual moves to another family and kind of forms that as a family unit and would like to move across the affiliation from one family to the next. You can basically use this function here called move insurees and then make the change. You just have to make sure that the head of the household cannot move. So if the head of the household actually has to move, then you have to change the head of the household within the group, which is also here. And then the other member of the family can be switched into added to another family. All right, I'll then move on to the next part, which was the claims process. And here in the claims process, there's basically different ways in which claims are also being entered in openIMIS across different implementations. There are some cases where they just fill up, health facilities still fill up physical forms, paper forms, and then send it. And at the insurance office, there's someone who's responsible for entering the claim. You can have cases where there is an offline client, so an installation which is made on the computer, and the person can then just do the submission, then take this extract, so-called extract of claims that they have entered on the offline machine, physically transport it to another location where there's internet, and then upload it into the system. or what I will show now is this online client. So you have a computer, you have an internet connection, a valid credential, and with that you log in directly to the server and make a claim submission. And you also have the mobile client for doing claim submissions. That's the part of how a claim gets into openIMIS, and then what happens after that. So there is, of course, internal checking, claims processing, which happens. And we just cluster this. I'll show you step by step how this works, but we cluster it as some kind of automated checks which happen. So if you remember, you had created price lists before where you had created certain conditions. Maybe certain things can only be used by male or female clients and not the other way around. So all these kinds of checks which you created, these are part of this automatic checking. So if the client status, for example, this is why I mentioned I gave you another ID, because if your client is not active, your claim will get rejected, with the reason being that the client did not have an active policy at the point when claim came in. So this is what is clustered under automatic checks. Then there is so-called manual checks, which is then reviewed by a medical advisor. So maybe any on the insurance side, there is one or multiple people who are responsible for scrutinizing these claims on a manually looking at it one by one. So that's also part of the processing. And then there's of course the final claim calculations which happens. So once the medical advisor has checked the individual claim, it's then sent forward, and all kind of calculations regarding remaining limits, etc., happen at this point. And then you can, of course, create consolidated reports, which give you an idea what amount has to be paid to the healthcare facility. So this is now what I'll quickly show on the demo server. On the app as well, it's like I mentioned, it's the claims app. The interface that you have also is, maybe it looks a bit different, but the data fields are exactly the same. So the process is the same of submitting. And like I said, just so that it's easier, and since you will all practice on the online system, I'll show you on the online application how this looks like. So what you see here now is, to keep in mind, is my account right now, which I'm using here, like you, is the admin account, which we have given access to everything. And that's not really reality. So a health facility, when they enter, they will not have, for example, access to the review page, because that's on the side of the insurance scheme to make a review. So in their login, they will essentially have less than what you see over here. They will just be able to add a claim. And the other thing which will happen is, right now in my case, I have to select my location and the health facility for which I will select a claim. I will add a claim for. But if I am a registered claim administrator from that health facility, these settings will already be predefined, and I will not be able to then enter the claim for another health facility. So I've selected now this particular health facility, this district hospital, Jambero, and I now add a claim. So in the claim, there's quite a lot of fields. I'll focus again on just the key ones here. So you start with, of course, an individual for whom you are adding this claim. So this is one individual which I just created right now. Then you add some dates here. So firstly, what date did the patient come in? So from when to when was the treatment valid? This is also one way of indicating for the system to know whether it was an inpatient or an outpatient treatment. In this case, I just say it's an outpatient treatment. And then the date of claim is essentially the date on which the health facility claims to the insurer. It can be exactly the same day, or it can be that the health facility decides at the end of the month. They fill up claims in paper forms, and at the end of the month, they do a full batch of 100 claims or whatever. So the date of claim can be slightly different to the visit dates. You then have the type of visits, regular visits. I had also shown you the configuration on diagnosis that you can have. If it's ICD-9, 10, whatever, you can also, or some other configuration, you can create these diagnoses here, and that's how the list comes up. So here you also start seeing how the configurations you did before, they really start to get come together. Now the claim number, this is a unique number which has to be given to that particular claim which is being added. And then you have additional things like secondary diagnosis, etc. Guarantee number is in cases where you have perhaps some kind of pre-authorization which is given and you have some kind of reference point to mention here. You have secondary diagnosis, tertiary diagnosis, etc. These can be also added here. In case there is any additional explanations to the claim, these can be added. And here you get in the block in the middle here some additional information if you would like to see regarding this individual. Maybe there have been past claims and that can be indicated. This is just the policy information again. But the main part now with regard to the claim that is being submitted is really here, this service and item. So what you configured before, I will just pick a simple consultation. It picks up the price directly from the system which you configured before for the cell facility. So a quantity, price, let's say some drugs were then provided. And I add, let's say 10 drugs, 10 paracetamol was provided here. So you can alter the units, prices are automatically there. And you can give an explanation if needed, why this was prescribed or so. So this is in a very simple way. You can also have attachments which can be added here to the claim. So if there is a report or so, or you want to give the actual prescription and add it here, these kind of documentation, supporting documents basically can also be uploaded. I'll just keep it simple right now and add a simple service, an item, and submit this claim. So like I said at the bottom right here, like I said, this is from the health facility side right now, which makes the first step of submitting a claim. At this point, the claim then sits in what we call this entered state. So once a claim is submitted from the health facility side, it comes into this entered state, and then the ball kind of moves to the court of the insurance scheme where the first level of checks have to start. So as I mentioned before, the first level of check is really the automatic checks. So now the person, whoever is responsible, a data entry clerk or so, can also, who is given access to do this, they will then be able to select this claim as I did now, and then say submit the selected claim. So at this point now, the claim has been moved forward through the automatic checks. And let's see, so this claim number was, I'll just copy the ID number and again come back and see what the status of the claim is. So I'll remove in the filters all status and only search for this one claim. So the status of this claim is checked, and that basically means the claim has gone through all the automatic checks and it has moved forward to the next stage. It wasn't rejected. So the next stage then, if you go back to the visualization which I was showing after the automatic checks, is the step which is done by a manual, by a medical advisor, a reviewer. So as a reviewer, again, they will not have access to all of these fields. When they come to claims, they will only be able to then review a claim. So when they come to this page, they essentially see, okay, what's on my plate? So here it's a simple list of 4 odd claims, but this is not really reality. In reality, if the scheme is big enough, you might have thousands of claims which are coming to the medical advisor. And generally, any medical advisor or group of advisors, what they do is at the time of scrutinization, they take a sample of these claims. So there are lots of these different filters based on which you can decide what kind of claims you would like to pick up and try to look at, and then really select from these filters which are here. So you could say, for example, I want to take randomly 5% of all the claims which were checked and take it through some kind of additional review from my side. Because I cannot go through all of them, you can apply these additional filters. The same way you have claimed amount above. So you can also say my filter now is above 1,000. Any claim which is above that value, I would like to review them. Or you could say this, which is the variance, which is every diagnosis in the system, it calculates the average amount which is being paid out. So if there is a variance from that average amount for that diagnosis, in this case above 10%, then filter those claims out and I will deal with only those claims, and the rest of them are kind of bypassed from this process of a medical review and go ahead to the next stage, can go ahead to the next stage. So in this case, again, to keep it simple and also for your exercise, what we will do is I will just select this claim directly. So as I said, you can apply filters, but you can also do it one by one. So right now, this is the claim which I sent, and the status here is right now idle. And for two things, one is the review, which is the medical advisor review, and the second is feedback. And this is also what I covered before. In case the medical advisor feel I would like to get more feedback from this patient, this treatment looks a bit odd, they can trigger this feedback. Information goes to the enrollment officer who's in the village and responsible for the family where the patient belongs to, and that enrollment officer should then go to that person and collect this feedback. And there can be questions like, were you actually given treatment? Drugs were prescribed, but were they actually given to you? Did you have to pay extra money? These kind of qualitative information then can be captured, which then the medical reviewer can see, and based on that make a call on the claim. Right now, I will say I do not select it for feedback, but I do select it for a review. So now, as you see here on the right, this gives you some kind of a log of the actions you're taking. So it indicates here that the claim has been selected for review. And then as a medical reviewer, I would open that claim, and you firstly get to see the exact same information which was there when you entered a claim. So all the details are there. For a medical reviewer, maybe it's also important to see whether this person had any past claims, to also understand what the history of this individual was and whether it makes sense now with this consultation. So that's also, in this case, this person I just created, so no other visits were there, but in case they were, that information is also provided. And then you have at the bottom here, the services and items, where then a decision can be done by the side of as you see here, the status is passed. So as a medical reviewer, I can say, no, I reject it. Or they can say they partially reject it. Maybe the drugs are too many, it should have been less drugs. So they can alter this here. And based on that, they deliver the review. So now the review has been delivered. The last step is to really take it through now for final calculations. So you will process the selected claim. And this claim now goes into what we call the evaluated stage. So here now all the calculations are done. And you will see here, that's the claim which I have now got through till the end. And the last part of this is the report. So if you go now to the report section and go to claims overview, you can basically now check, this was one claim, and the same way hundreds of claims are dealt with. So you can then check, that's the health facility for which I just entered this claim for. So you can then go back, one claim, two claim, 10 claims, whatever. And then I'm checking now in April. So I see here, there's these two claims, and the bottom one is basically what I entered right now. Yeah, that's basically here. So that's the bottom claim which I have. All the details of the claim, what was claimed, what was approved, what was adjusted by the claims reviewer, the medical reviewer, and what is finally paid out. So I hope this was clear. I'm sorry it took me a bit more time than I expected, but I would ask you to maybe just quickly do another short exercise to try and enter a claim from your side. And I will quickly show this on the slide. So again, go to the demo server. Please try to add, I mean, for the individual you have, or just take the ID number which I gave and try to submit a claim. Move it forward through the different steps which I mentioned. So first entered state, then move it to the check state where you do the automatic checks, then the medical reviewer, and then further submit it. And if possible, try to then go to the claim overview report and have a look. Cha, maybe we can do this for, let's say, 8 minutes and then come back. I hope, Dr. Chamika, your question, you were able to get an answer. I will maybe just also ask you in terms of time, if you can just bear with me another 5 minutes or so, I will wrap it up with the last part on renewals. We won't do an exercise there. Um, and then maybe I'll go into the question. So Dr. Chamika, I'll come back to your point perhaps after that. But so I'll quickly just go to the renewal process here. So again, it's there are many different ways in which renewals are happening in different openIMIS implementations. There are the more kind of manual processes where or not manual, but more kind of offline processes, which are also being supported by openIMIS, which means you can print out lists, physical lists of people who are supposed to have a renewal upcoming. So people whose policies are expiring, and these can then physically be given to an enrollment officer who then on the phone can renew these people. This can also be in case the same kind of renewal list can be taken in form of an extract and then physically taken to the enrollment officer and put on their phone so that they can do enrollment. And everything done on the phone cannot be done completely offline. And if there's no internet, then the same extract from the phone can be taken and then brought back to a place where there's internet and then uploaded to the system. We then have a case where we also had SMSs. So I will explain in the next step one specific case in Tanzania where SMS also go directly to clients so that they can on their own do a renewal, but this is valid only in cases where they can make mobile payments or any form of electronic payments, but it's mainly mobile payments which are being taken. Or otherwise, SMS can go through to the enrollment officer who can then follow up with respective clients based on the information received in the SMS. Or the most standard case, which is the phones that on the phone using data transfer, the system basically sends like a checklist of these are the 50 households or so which you have to enroll in the next month. And that then the enrollment officer can take and then undertake the renewals. The point which I mentioned in one special case, which is there in Tanzania, where clients can also directly receive SMS from the server close to the time when they have to renew. And that then gives information like the USSD code, etc. And the individual, if they are using mobile payment, they can essentially go through the USSD code through the menu, get the relevant information to actually make a payment through their mobile phone. And that payment, once it gets to the server, it's the policy is immediately activated and confirmation SMS comes back. So that's just basically the process of how this happens. And on the mobile phone, it's basically the part which I mentioned where on the app, you get like a checklist, you get a list of people. So I've added here one individual whose policy is going to expire now. Well, now it's actually not. So I must have, or someone must have renewed it online. But basically here the list of families come up. So in this case right now, there's no renewals left for this individual to undertake. But that's where the checklist come. And on the system, it basically, I've opened up, this was the household which I picked up, which is going to have a renewal. And this is what should be on the application. Basically, that's an individual whose policy comes to is going to get expired. This is actually still active because our servers are in a different time zone. I was just checking this before in the last session, but essentially the idea is that once the policy gets expired, it goes beyond the expiry date, then the status will be expired. So this is close to that expiry date. So I just show it as an example. And in this case, let's say a paper form was used to undertake the whole renewal process, and the form has come back. So the information has come back, the money has come back to the insurance office. All they do is that the family structure remains the same. All the individuals are the same. All they do is just click on this R button for renewal, and they renew the given policy. And then it's the same information. This new policy is created. It gives you starting date, expiry date, which enrollment officer actually did this renewal. The policy value is indicated. And as before, you have then a new policy created, which is idle right now because no payment has been done. So the same way I add a payment here. Oh, that's a oops moment. So the same way I add a payment here like I did before for a policy, and you can indicate, I think there is a small error here, but the policy due value I think I saw was 5,000. So you would make the payment for the policy. And once you make that payment, the policy also then will become active. And that's basically how the renewal happens on the system. And the same way it works on the app, where you get details and you can enter the payment information along with the product. So I'll quickly wrap up here, and that's basically the end from my side. Let's quickly move to some questions if there are any. I've also added in the slides some additional practice in case any one of you is interested in playing around further with the system. I know the time was less, but we were trying to package a lot of things into very little time. So I hope you at least got a flavor of some of these things, and you would be interested to really go back and test it out. So that's what the kind of exercise which I put down here was. Um, just putting together everything that you've covered in the last 4 sessions. So bringing together that, try to create your own scheme from your respective context. So add geographical locations, price lists, facilities, etc., and just kind of simulate it for a month. So you don't need to do it literally across a month, but let's say you take the last month and try to enroll families, try to enter claims, and then just look at the performance. I've indicated two reports here that you can look at. And if you're interested in engaging further, you can also go to the wiki page here and just add the reports that you generated. So that's kind of going to be a summary of all the actions that you have undertaken for all the transactions that you had. So I hope with this I will kind of wrap up. And are there any questions, Cha? I think there was.
I think there was only one question from Dr. Chamika
Chamika.
earlier. Yes.
Yes. Okay. So I'll quickly, Dr. Chamika, to your question. Um, I did not. I did not manage to go back and check for your claim, but basically your claim was in an entered state. Unless it has moved right now, I would hope I can see it. No. Yeah. So the point is, when you create a claim and you. Sorry, that was why. So for example, this claim here, I think maybe you have moved your claim, but if you look at this particular claim, your question was, I think, how to move it forward. That's how you move it forward. Submit selected, and then it goes to the check state, and that's the state where a medical reviewer can then check the claim. Yeah, so in your case, as you said, it moved to rejected. You can also then go back to the claim, just go to the rejected state here in the filters. That's your claim, and you should have an explanation why this was rejected. You've added quite a lot of things. So this is why in my example, I said try to use something simple. Here, the reason is item service is not covered by an active policy of the patient. So my guess is probably what has happened is this is an individual that you added. And as I was flagging before, that if you don't have an active policy for this individual, if you don't have an active policy, you cannot approve a claim for this individual. It will automatically get rejected. So probably that's the reason why the claim got rejected here. So this is why it was important to activate and otherwise use another household which was active at that point. All right. If there are no questions, I will just wrap up on my side then. Like I said, we've given some additional resources here. I mean, I've mentioned about this additional practice. If you would like to do, you can also communicate with us further through that. These are some general links, etc. You can always go back to. There's more documentation, etc., which is available. And yeah, I mean, feel free to get back to us through AHIN or directly with anyone. Um, and thank you very much for your time and for having bared with me. I've gone slightly over time. But thanks a lot, and I hope you found it useful. Please do try to practice it on your side. And one more thing to mention is this was the end of module 1, which was, as I said before, introduction to openIMIS. Really the front end, the use of the software, how do you enter claims, etc. That's what I covered. We will also have module 2, which will information will be shared soon about that. And that's a more technical module for those of you who might be interested, or your other colleagues who might be interested, which will be on installation and country customization. So this is a more technical bit of how you install the software, how do you make certain customizations, changes which make it country specific. So please do keep an eye out also for that. And thanks a lot also, Cha and Ahin, for having organized this. Thanks very much.
Hi everyone, this is Christine from AHIN. So on behalf of our leaders, we would like to thank each and every one of you for participating in this 4-part openIMIS training. And of course, we would like to thank Siddharth from the Swiss Tropical Public Health Institute for facilitating these sessions. So Siddharth has been sharing his time and expertise with us for 4 weeks now. So thank you, Siddharth. And as part of the openIMIS initiative, AHIN has been forming a community of practice on the use of ICTs for health financing and health insurance here in Asia. Most of our members are from health education institutions. So we have UP Manila, St. Luke's QC from the Philippines, the University of Gadjah Mada from Indonesia, and also SSL in Sri Lanka. In this community, we try to demonstrate openIMIS as a learning tool in medical universities. So students will have a practical understanding of how health financing works with the help of technologies such as openIMIS. So there are many use cases that openIMIS can support. Before we end this session, we would like to take this time to invite everyone to join us in this community of practice so we can all learn together. So just send us an email, and if you have further questions on the training, we'll be happy to link you with Siddharth and other openIMIS experts. Thank you, everyone.
Thank you, everyone. Bye.
Bye.